Welcome back to Vitals and Values. And today we are doing a topic that's been on a lot of people's minds. So, vaccines. And more specifically, today we are focusing on the hepatitis B vaccine at birth. And I think this question has been coming up more and more. At least I've been hearing about it and seeing it in my own practice. And especially with the more recent attention and conversation around vaccines, policy, and public health. And so patients are hearing a lot of different messages. And many people are trying to understand what the recommendations are and what is the right choice for them. And so David sent me a post from Dr. Terry Simpson, someone that you said you were connected with on TikTok, I believe.
Yes, that's how our relationship started. I'm super appreciative of Dr. Terry Simpson hopping on here because it was the perfect timing. We had just brought it up, and I was like, he had just made this post debunking someone on some of these different conversational anti-Hep B conversations, and I was like, perfect. We were about to talk about this. We'd love to have you on and collaborate this conversation. So I appreciate you hopping on here.
My pleasure.
And I was gonna say, Dr. Simpson, for those of those listening that don't know you, can you tell us a little bit about yourself and what has led you to be talking about this specific topic among others?
Well, I actually started out life as a virologist. So before
I
I
didn't
went to
know that.
medical school, before I went to medical school, I did virology at the University of Chicago, published a number of papers in molecular virology. One of my first gigs, I'm born and raised in Alaska, and one of my first gigs as a young virologist was collecting some samples in Alaska with the CDC. I then decided I liked people more than petri dishes, and I went to medical school. I thought I was going to go into infectious disease, but I found that they were kind of boring people, so I ended up going into surgery. I never knew that there would be an intersection between all of this until COVID hit, and I've spent most of my career doing education, helping people with misinformation, helping people avoid cons. Turns out that the hepatitis B is kind of important to me because I'm one quarter Athabascan, Alaska Native, and the hepatitis B story actually began in Alaska Native villages. We had quite an outbreak. So we had some of the highest rates of hepatitis B virus in the world, as well as hepatocellular carcinoma. And we had about nearly 30% of our Alaska Native population was hepatitis B positive. And so in 1984, when you guys were still rather young and I was a young virologist, we began a universal infant vaccine program starting at birth. And then we ended up vaccinating more than 42,000 people in Alaska between 84 and 88. And so we first, not surprisingly, saw the hepatitis B infection rate decrease from about 200 per 100,000 down to about 5 per 100,000 over that period of time. We've had no cases of acute hepatitis B vaccine that have occurred in children since 1992. Hepatocellular carcinoma, which is liver cancer from hepatitis B vaccine, in people under 20 years old, decreased to where we've had no cases since 1996. And our hepatitis B positive children under 20 declined from about 657 total in 1987 to just 2 in 2008, which was the last time. We were the ones that sort of led the nation saying, you need to do this early because every day we did it late, we saw an increase of this. Now, we tested all the moms. So clearly, when a mother had hepatitis B vaccine, there was no question. Nobody disagrees with the vaccination. But over half of the transmission of hepatitis B came from caregivers, aunts, uncles, sisters, brothers, people who had to put their children into childcare. And while for adults, it can be a sexually transmitted disease, it can be a bloodborne illness, for infants, it's not. It can be collected by, the hepatitis B can survive intact on surfaces for up to a week. And so most people think hepatitis B in terms of adults. They say, well, kids aren't going to have sex. Kids aren't going to be exposed to blood. Kids aren't. And it's like kids have such a poor immune system that they pick it up almost anywhere. They can pick it up from a toy. They can pick it up from bottle caps. They can pick it up from almost anywhere and get it. And it's absolutely devastating to it. So the arguments that I typically hear is, well, the mom tests negative. Why do we want to expose the kid to this? Well, the answer is because you want your kid to test negative too. So all of that background started in, my home state. And And all of that early research started in there. And so now it's come around where the advisory committee had all these usual anti-vaccine arguments. And it starts out with the lack of understanding of the virus itself, the virus transmission itself, and the horrific things that will happen. So, well, what if we let it go for 2 months? Well, and Denmark doesn't do it for 2 months. Well, Denmark has a few things we don't. Denmark tests everybody for hepatitis B. Denmark has universal health care. And Denmark allows moms, when you have your kids, to have a couple of years off just to help raise the child. We don't have that in the United States. I mean, it's horrific that, a mom has to have a child and practically 10 minutes later has to go back to work. But that's just how our society is. And so when you have that as a society, you have to understand that, your children are at more risk. The other one that I hear frequently is, why should kids get all these vaccines? With the idea that you're exposing kids to too many of these foreign antigens. And I didn't go into pediatrics for a very good reason. I'm not really good with kids until I had one, and then then I'm kind of one and done. But if you look at kids, they pick up everything and put it in their mouth. They are getting more antigens per day than the number of vaccines that we give a kid from the day they're born until they're 30 years old. And people don't understand that, think a shot is something magical, and it's just not. It's just an effective way to get the vaccine to them. So you have something that's protective, and they say we haven't tested it against placebo. We have. It's been tested against placebo in China. It's been tested against placebo in Korea. And now to test a vaccine against placebo and you have an effective treatment is unethical. It should never be done. So they were wrong about that. They said, well, we don't have any follow-up. The follow-up was only 4 to 5 days. It's like, in Alaska, we have 30 plus years of follow-up of this. These kids are thriving. The kids that aren't thriving, the kids that didn't have it before. I always have these couple of stories. There's so Alaska has a couple of big cities. I grew up in a small village of about 5,000, which was the third largest city up there.
That's fascinating.
And so you have these villages, and I remember there was this one young gal, and she was the pride of the village because she was going to be the first one to go to college. And then she had some abdominal pain, and they found out she had liver cancer. She died. So here was this first one going to college, going to the University of Alaska, and she had liver cancer. She had a full ride scholarship, the first one of that village. They were so proud of her, and she died of something which is now preventable. And I mean, when my son was born, he had everything and continues to have everything. He's 15 now. But to think that poor life was wasted. And that wasn't the only one. I have a very good friend of mine whose son had liver failure, had a transplant, and unfortunately died about 5 or 6 years after the transplant. So transplants are pretty expensive and a horrific thing to do to someone who's a teenager. And hepatitis B vaccine is a pretty benign thing. We have a lot of data that people don't look at it, don't understand it. It's either a willful ignorance or the most awful kind of duplicitousness that I could ever imagine. There's my Sunday sermon.
I was about to say, you
That's
hit
great.
almost 80% of talking points in 9 minutes. Is that the end of the podcast? Because I was
Yeah,
no, I'm
that's
just
it. I
kidding.
think you covered it all. That was awesome.
It's almost like you've done that before. Well, I appreciate that incredible depth. I mean, I didn't know you're from Alaska. I mean, actually, I did towards the end, but not till recently that I didn't even know you were from Alaska. What a fascinating upbringing. Dude, I could go into a whole tangent there. I love at the end you kind of alluded to this point. Lara, do you have any missing before we even go to that, do you have any missing science, different clinical studies or anything you want to kind of touch on that Dr. Terry Simpson didn't?
Well, I mean, I'm sure he knows all this, but from the effectiveness standpoint, we've seen from research that the universal infant vaccination was associated with about 75% reduction in hepatitis B vaccination across birth cohorts. So the group of children born in the same time period and followed over time. And so I think that's a huge number for people to remember, as well as other separate systematic reviews that have been done that examine dozens of studies, including the RCTs, which I know you mentioned, Terry, that yes, they have done those. And they found that the median seroprotection rate was about 98% when the vaccines are begun within the first month of life. And that just simply means that the body's producing enough of those protective antibodies to prevent infection. And so I think this just amplifies what you said, that this vaccine works.
And it's long lasting. I mean, we
Yes.
have right now, the last data that I looked at was about a year ago, and we had 22-year follow-up. So I'm on the board of one of the primary care centers in Alaska, so I still get to look over all of this data and the research that goes on. And we have 22 years of data now looking at the efficacy. And in 22 years, the hepatitis B vaccine still allows these now young men and women to produce enough antibodies. So it's a pretty good vaccine. It's pretty solid.
Well, and because I saw from a safety standpoint, because I know people are always worried about this, that there's minimal. I think I read that there's one case of anaphylaxis in a million vaccines, and that was about all other than like local skin reactions. So are you familiar with any other issues that people talk about?
No, I mean, I hear them talk about a lot of issues, but again, we have probably the largest collection and longest term collection of data. There's nothing we've seen. But I've also come to realize that there is a group of insidious anti-vaccine people that make stuff up. They cherry pick data. They will pull a study apart and say, well, see, this shows this. The latest horrific one was when the Stanford study, this was about the COVID vaccine. The Stanford study came out showing how myocarditis develops with the spike protein of the COVID. And so people said, see, we knew the vaccine caused it. And it says very clearly in it that if you get COVID, you have 10 times the amount of the spike protein, actually even much more than that, and have 10 times, well, we know you have 10 times the risk of myocarditis and longer lasting myocarditis. There have been no viral myocarditis in young people from the COVID vaccine where they've done anything but recover. But there are plenty of COVID patients who haven't. But they took that one little bit and said, see, they've been lying to us all the time. And so these people who are anti-vaccine are not honest people. Now, most of the people are honest. They have questions. Who wouldn't have questions, right? You wouldn't want to worry about your infant baby that they're not getting something they don't want or don't need, and you will always worry about that. But these anti-vaccine people, some of them are such horrific stalwarts against it that they just make stuff up, and that's just unacceptable.
And that's where like the kind of the transition of this conversation gets very interesting too, because obviously primarily this is for end patient care. This is for actual parent have questions. And I think it's super important because like in today's level of, we all know fear drives through social media at an incredible pace above just context, nuance, scientific fact. And so, and you can understand how parents today feel overwhelmed with how fear is one of their primary drivers on social media. And I get it. I like this quote that came up with is good parents ask hard questions and good doctors respond with grace and clarity. And that's one of the things that,
except surgeons, we're not very graceful.
And that's actually one of the things I have found struggle with, because I've heard enough from friends and people around me where they go to their primary, they ask some of these questions to their primary about like this vaccine, that vaccine. This is like Lara's in concierge medicine for a reason, because she got sick of 7-minute primary care, 15-minute primary care where she couldn't give depth. And so you can understand how doctors start getting short because they're like, I got 17 things I got to get done in 9 minutes.
No, I mean, but it's still inexcusable. I mean,
yeah.
When we put together our primary care system in Southeast Alaska, you have all the time you need with the patient, and we make sure that's there, and you get same day access. So it can be done. The models are certainly there.
Mm-hmm.
But it's unconscionable that a doctor would take that time. But I also think the other thing is, quite frankly, many doctors don't know. They don't know the nuance of the data. I just happen to be this weirdly trained virologist surgeon that is on the board of Alaska, and is from there, and saw this growing up and was a part of it. And that just happens to be that thing. But very few people have that background. And so when all of a sudden you're confronted with information as a physician you don't know, it's either, people hate you looking up stuff, but you have to have that humility to say, I just don't know, and let me look it up right now. And so it's difficult. So I think that's where people do come to social media, to find people who are going to say, here's the real data, and here's what this means. And on Twitter, I'm much more vicious on Twitter than I am on TikTok or on Instagram, because, these people are just relentless and awful individuals. And
that's
and
always
again, yeah, go ahead.
Yeah, I was going to say, that's always the tough part with me, where it's like, like one of the things with science is one of the fun parts. Science is truly, when you understand the scientific method, it is one of the most ruthlessly vicious, challenging places to be, because you have to constantly support what you're saying. And there's there's gravity in that, which is super important. But like being able to follow the truth and trying to be, I've been wrong more times than I can count on different
We're
subjects.
men. It just happens. It's the worst is yet to come. Congratulations, by the way.
Thank you. And that's the angle, which is like, but it is so fascinating to me out of professionals where they know better. They've been taught these things and they still.
I think, but I mean, and the difference also is that now I'm not a humble person, but science is humility.
Mhm.
We don't say things like, this is proven, this is the way it is, unless we're talking about gravity or prions or something.
Mhm.
But we can't come out with those declarative statements. We can say, yep, I mean, 1 in a million, you're going to have a reaction. You just are. But when you look, and the other thing is people, the average person doesn't understand basic statistics. So our job in science, and what's become sort of the favorite part of what I do, like I'm giving a lecture on how to spot a con in the next month in LA at something called, but I think we can't make those declarative statements, whereas they can. And so we sound like we're waffling. It's much like, so I always hear this, Fauci said it wouldn't cause transmission, would be absolutely stopped by vaccine. Well, he said no such thing. And actually, if you go back through all of the things, and I've gone back through them, he said, here's what the data shows. It appears to decrease transmission. Now, other people said it would stop transmission, mostly the politicians, and they were wrong. And then you have people saying, well, they said you would never get COVID if you got it. I said, we don't say that about any vaccine, even smallpox. You actually do catch the virus. You just may not clinically manifest it if you're lucky, or you might manifest it a little bit. So we can't speak in absolutes, but they get to speak in absolutes. So it's an unfair debate. Because they always want to debate us. There's always somebody who wants to debate me. Usually it's a functional medicine chiropractor that wants to debate me. And because they have all of these absolutes that they can say, well, natural is better and I can cure the root cause of disease. And it's like, vaccination kind of fixes the root cause of disease. Guess what? We got rid of hepatitis as a cause of cancer. It wasn't because they didn't have spinal manipulation. It's because they no longer got hepatitis B infecting their liver, causing a chronic disease, which led to inflammation, which led to oxidative stress, which led to DNA malformation, which led to predictably liver cancer. So we actually got to the root cause here. We can actually show you the statistics. And so we're in an unfair fight. And that's why we will never win at a debate, because we're going to be nuanced, because we're going to be humble about the data. And you know what? Sometimes we're going to be wrong. And the difference between us being wrong and people who are cons is we will admit we're wrong because it shows we hate it, by the way. We absolutely hate it. We're not inhuman. We hate being wrong. But, I've been in the game long enough that, and certainly when I was, active in a wet lab, it means there's a more fun solution out there, and typically a more elegant solution. And it's really pretty cool. And so, our human nature gets backed into a corner when we're wrong, but our science nature, which is what you have to learn to overcome it, is there's something better out there. There's a better explanation. This is great. So, but again, you fight in absolutes against people who, say, well, if you just take vitamin D, it gets rid of all the measles. It's like, well, it does help immunity a little bit if you're deficient. But so
now, I know one of the big questions on hepatitis B vaccines is, at least I hear this from parents all the time, is do I have to get it at birth?
Yes.
Can't I wait till 2 months? So how do you Thank you. Can you explain that to people?
Sure, because, they are going to not be the only one in charge of their baby. They're going to hand it off to someone. And you cannot tell if someone has hepatitis B or not. Now, we have a low level in the United States, mostly because of all the vaccination we've done. But you can't tell. You can't tell if I have hepatitis B or not. You can't tell if you do. But there's no outward manifestation. And obviously, if someone is yellow and, they're probably not going to hand your baby off to them. But when over half of the transmission occur from caregivers, it's not just the mother. And if the mother's going to be alone with that baby and the sole person there, and they've tested the father, and no one's going to come in their home, and their home has been deep cleaned against all hepatitis antigens, then sure. But what's the point? because at 0 years of age, you are not hurting the child to give them a vaccine, but you're giving them protection. It's like, do you want to take that risk? Do you want to take the risk of your child being like that valedictorian from the high school, the first one of her village to go, but she ended up dying of liver cancer instead because she had hepatitis B that she probably got not from her mother, not from her father, but from some caregiver in her youth? You don't want your child to be that.
I think that good parents don't expect to be bad statistics, and they don't realize that they still could be, which is what you heard in Alaska.
Human beings are incapable of understanding big numbers. We heard this during COVID. It only affects 1% of people will die. And it's like, well, 1% of the nation, that's about 4 million people. I mean, you ever think about that's 4 million people? And when someone says, well, I never knew somebody died of COVID. Of course, I've known hundreds, but because I'm a doctor, but it's like, have you ever known anybody die of esophageal cancer? No, but I know it exists, right? Yeah.
It was brutal. One of the DMs I got from a buddy of mine. Again, sometimes there's a difference between being blunt and being mean, and sometimes
I'm blunt and mean.
And I was trying to dance this line with a buddy of mine because, like, after I made this post, he responds with, "Well, none of my kids got any of the jabs, and my kid got nutritional vitamin K instead of injectable vitamin K at birth." And it's a whole nother
Sure, they
thing.
absorbed that really well, didn't they? Thank
Yeah.
God they didn't have a brain bleed.
I know.
Otherwise, they'd have been a Republican.
It's brutal. And so friggin'
And I say that I'm actually a registered Republican, by the way. Just,
well, and this is the funny part. When it comes to a lot of the on the science stuff of the Maha movement right now, I lean conservative. Like, I'm just being real. But this Maha stuff is just brutal. It's just so bad. But like he said to me, he goes, well, my kid's a year old and has been healthy as an ox, basically. And I'm like, man, that's like saying my grandfather lived to 90 smoking cigarettes. Cigarettes
it's the
isn't
same
bad
thing.
for you.
I always
I'm like,
encourage people to go look at a cemetery. Go look at the
Yeah.
cemetery before we had vaccines. Look at how many children's, cemeteries are there. And it's like, yeah, clearly some people survived, right? Those people who survived are the ones walking in the cemetery. That doesn't mean you're any healthier. It means you got lucky. It means you didn't happen to run into that virus. And that's great. But don't put that on anybody else. It's great that you took that chance and you didn't get it. But how would you feel if you took that chance and you missed? How would you feel as a father? How would you feel as a mother? You took the chance because you thought this was better and you missed that nutritional vitamin K, which was not absorbed by the child. How would you feel if that child had a brain bleed and now you were taking care of the child for the rest of your life as this, horrible person, not a horrible person, but as this horrible disease living with G tubes. And I mean, because you were too stubborn to listen to science, because you thought you knew better than the doctors. And it's like, what would happen? What would you give to not be in that position? What would you change if you weren't in that position? My brother died at age 55 from lung cancer. I know that my brother, and he had given up smoking 5 years before, but he'd smoked for a long time. But I know if he could have gone back in life, he'd have stopped smoking, of course. So it's like, yeah, you can beat the odds. You can play golf when there's lightning out. Would you do that? The chance of getting struck are small, but you clear the course. Why? Why do you clear the course? Why don't you just take your chance out there? Well, it could kill me. Yeah, it could.
Well, here's a great statistics for you. I've been golfing my whole life, and I'm a pretty good golfer. I'm like a 5 handicap. And here's Lara, her first year taking up golf this year. She hit a hole-in-one back in August. And I'm sitting there going, all right, statistics, this is not for this.
So you're in Michigan. There's this great Ross designed course up in sort of central northern Michigan, which is all of Ross's, like the 18 holes that are all different holes that he designed somewhere. And I can't remember where it was, north of Traverse City or something. And I played it when it was 40 frigging degrees outside. And I got through 18 holes in an hour and a half.
Yeah, you're gonna keep your pace on that one.
Yeah. I wouldn't have made it that far. Now, you mentioned that you have been early in this whole hepatitis B vaccine conversation because of your history in Alaska. And I was just curious, how have you seen the perception of that vaccine change? I mean, were people back in the 80s as hesitant about it at birth as they are now?
No. I mean, remember, it was a different era. The anti-vaccine people back then were these weird little cultish sort of people. They're in some of these bizarre Christian cults. Um, and um, and so it was pretty rare, and we always knew those people were weird. And what has happened is anti-vaccination has spread because all of those weird people got together and formed a groups on whether it be Facebook, TikTok, wherever. And now they have this power of voice, and it's enough people talking that instead of it just being the one weird guy in the village you grew up in, which was, now it's hundreds of people telling you all of these things and repeating, you start thinking, oh my, maybe they're right. And it's not very often that you get people who are articulate that can defend it, because you end up getting in these brutal conversations, which I don't mind, but so back then it wasn't a problem. Back then we saw the problem up close because we had such an epidemic. So we saw it close and personal. So when you see it close and personal, when you bury kids who are in their teens because of liver failure, when you see someone that dies of liver cancer who isn't even 25 years old, when you see all of these people who are positive for hepatitis, 22% of your population positive, you get to see what can happen very quickly. And so they were more than thrilled to be able to, participate with the CDC and get that under control. And it was sort of experimental at the time. It, quite frankly, was very experimental to take kids and vaccinate them on day one, and just because we knew what they were going home to.
And to be honest, that's always the classic. That's one of the things with medicine is very important, is you have to start small, make sure there's no whoopsies. As you scale it, you create a larger cohort. Now you're like, okay, we have enough established process. Like once you get to the position where we're talking about a macro level, there are so many checks and balances. I think people just don't understand. I'll admit, just kind of talking a little bit of devil's advocate on like, there was enough goofiness in the COVID timeline, which we totally get. Things were crazy when you saw the Italy numbers where it was like a 24% mortality rate with all this kind of stuff. You're like, oh my gosh, we need to shut everything down. This is terrifying. And then as things kind of progressed, as we learned, there is so much uncertainty, and you were seeing how the scientific method happens in a public setting. But the problem
And that's hard
is
for people to realize when we
exactly
were wrong about some things, and we had to rethink them.
Mhm.
We weren't wrong in flattening the curve and shutting it down because our hospitals were overwhelmed. I mean, our hospitals were essentially closed to any elective cases. One hospital, which is, it's about 3 wood from where I live, and it had a brand new hospital wing. It opened up, and it had an old hospital wing which it had to reopen for non-COVID patients. The other hospital I worked at, we were licensed for 30 vents. We had 230 people on vents, so we were just stretched to the limit. And when the
Mhm.
vaccine came out on December 18th in California, I was like the 12th person in line, and I shoved my way in to get the vaccine. I was so happy to be able to get it. And I think, you know, we've certainly learned a lot of lessons, but we had to shut it down because we were just overwhelmed. And
You didn't
that's, I
know.
mean, one of the reasons that we see this increase and rise in cancer now is because all these people weren't testing themselves for cancer in 2021. They just weren't. You were
Yep.
afraid to go to the hospital. You went to the hospital. I saw more perforated appendixes then. Why? Because people would have abdominal pain. They just put up with it because they didn't want to go to the ER. That's when someone's breath could kill you. And so it's really and we made some mistakes. We may have overdone things. We probably didn't need to shut down the schools. I mean, there was a lot of things we could look back on and say, maybe we were
Uh-huh.
right, maybe we weren't. But that was science in real life, which is we don't have the exact answers. And we didn't do this because we had the exact answers. We did this because this was the best we could do at the time. And would we do it differently now with the next thing? Maybe. But man, that was a rough world.
And I think it's important. I'm going to quickly share my screen. I took a clip from, if it's going to load. I took a clip from a 2004 published CDC because I wanted to make sure people understood like how effective this process has been with rates and all this kind of stuff with adding the vaccine, the hepatitis B vaccine in children. And I mean, it's so crazy to me from like 1990 to 2002 how we've dropped the rates by 95+%. from this from this incredible advancement. And it's like, this isn't theory. This isn't like, well, we like the uncertainty of things. It's an extremely well established benefit at this point, and it's not like something we're dancing around and acting like, well, we don't know at this point. Like, again, Dr. Terry's a little more elegant in saying, hey, we don't speak in absolutes, but it's like the numbers speak for themselves.
Well, we've certainly seen a reduction. We've seen what we would expect to see in the best of circumstances, which is a reduction of deaths, a reduction of liver failure, a reduction of cirrhosis, a reduction of liver transplants, a reduction of cancers. And if people were to ever see teenagers with any of those things, they would completely, I believe, rethink, because people believe in stories more than they believe in numbers. Numbers are hard to understand. Stories are easier to understand.
Mm-hmm.
And that's sometimes we just have to tell stories, and it's like, do you want to take that chance? Are you willing to do that for your child? Most of us are going to have 2 or less children. And like I said, I only have one. He's 15. That kid got every damn vaccine that was out there the second he could. It's like, I'm not doing this again. But I think, and we don't have the attitude that we're going to lose children, but it's one of those things that people believe in anecdotes and they will believe in the solid voices, but and then being able to have the data and put it out there is also important. It's
Mm-hmm.
just that, again, we can't ever argue in absolutes while the other side can.
I think I was just going to say, I feel like so many patients, when I talk to them about prevention, we want to prevent things instead of chasing it once it's developed. They're like, yeah, I'm all about that. And here we have vaccines that are one of the best ways to do prevention. And I feel like a lot of these same people are very resistant to that. So I just think it's a unique way that people think and what they choose, why they do the things they do.
Sure. We have the cognitive dissonance. I mean, because you hear these horror stories. It's like every time some young athlete dies, you'll see, did they get the jab? And it's like, no, they didn't. I mean, of course they had the jab. They were in high school football, but that's not what killed them. They had hypertrophy of the cardiac muscle, which has nothing to do with, the jab. And yes, the J&J vaccine did cause 5 deaths from bleeding and clotting. So yeah, there were issues. And there's no doubt about that. But there were far more issues from COVID, right? I mean, I have patients who lost their legs because they had clotting from COVID. I have people who lost lots of things. So it's really difficult because we're fighting against people who are lying, and we're fighting against trying to explain the science. I'm fighting against people who will use an anecdote when it doesn't apply. Well, I know 5 people who died from the jab. And it's like, no, you don't. You don't know 5 people who died from the jab. You don't know 5 people who died this year. No, you're lying. And they do that. They'll lie. I don't know anybody who died from COVID. Okay, fine. But I know a bunch of people who died from the jab. No, you don't.
Well, it's like on that one, it's so interesting too, because speaking of the J&J, people love to talk about natural as better and like, from all intents and purposes, what it looks like, mRNA vaccines are the future. Like, how it looks.
So glioblastoma multiforme, the most deadly form of brain cancer there is, for which we have no treatment that is very good. There's no treatment that, will cure it, except now we have an mRNA vaccine that has cured several people for the first time in history. Pancreatic cancer, which is, 55,000 people a year lose their life from pancreatic cancer. We now have some mRNA vaccines which are showing tremendous promise against pancreatic cancer. So we're coming into an era where the very thing that is being defunded, the very thing that they're worried about, is actually going to vaccinate against cancer. Now, if you ask someone, would you vaccinate your child against getting a cancer in their teenage years? Sure. Well, that's what you're doing with hepatitis B. My son got Gardasil, right? Gardasil. I know he doesn't have my son doesn't have a cervix, but he has other parts that can get in contact with those. So he's vaccinated against it. And so we actually
correct me if I'm wrong. With
Yeah.
J&J, I just want to finish that point, because J&J was a quote unquote dead viral
No, it was live.
But it wasn't mRNA. It was the old model.
No, correct. What it was that they took a gene off of the adenovirus and they put the spike gene on it. So the virus would infect you. And it would be a pretty mild infection. It would produce the spike protein. You get the antibodies against the spike protein, and the body would both kill the virus ultimately because it's a simple adenovirus, and then you would develop antibodies against the spike protein. But it did cause, and probably the number of spike proteins it produced was a lot. And that's why it's actually a fairly long-lasting vaccine of all of them. It's pretty long-lasting, but it did have those 5 deaths that were attributed to it.
Mm-hmm. Yeah, because I always just find it funny where it's like, well, at least this was natural, like a more and it's like, who cares? Like it doesn't it's a mute point. This whole natural versus artificial.
The other argument I hear is it used to take 5 to 10 years to get a virus vaccine. It's like, well, actually, it was never 5 to 10 years. The Salk vaccine was developed. Salk tested it on himself and his kids first, and sometimes we put the vaccines through it. But here we can make an mRNA. I mean, we had the genomic sequence of the COVID vaccine, of the COVID virus, on January 6th or 9th of 2020. So, and from that, we were able to make the mRNA vaccine. It took all those months to get it through the process. We had hundreds of thousands of, well, I think about 40,000 people per test group that was looking at it. So that's just simply not true. There's not a length of time you need to test something. There's efficacy, toxicity, and then you have ongoing monitoring of it. So it's like, if we have another pandemic, the next pandemic would, that we're looking at that might come would be the bird flu. You're going to want to get a vaccine very quickly against that, because if that goes to human transmission, it's going to make COVID kind of look like a walk in the park. So
now, one of the last talking points I wanted to kind of hit, because it's a classic one, which is Hep B is kind of rare now because the fact that everyone's vaccinated and the viral load in the country is relatively low. So why would I get it? What's kind of your kind of walkthrough on all that?
Well, I think it's much like, why do you wear a seatbelt? Why do you buy a car with airbags? Why do you spend the extra money for a crumple zone on your car when running into having a front collision is less than 1 in a million? If you're going to talk about odds here, would you take the odds of that? It's like you have a 1 in a million chance of something which is non-fatal for the child versus the high risk of that child, if they come in contact with hepatitis B, losing their liver, whether it be liver failure, needing a transplant, death, a liver cancer. Would you take that chance with this precious baby? And that's what you're looking at. And so it's great that we have very little of it. We had a lot of it in Alaska, and I think it's legitimate. I mean, and we got rid of it. So it's great that we got rid of it. And we want to keep getting rid of it. We'd love to get rid of hepatitis B, and that's something we can, we're actually looking at doing. We can actually get rid of hepatitis B as a viral vector in the world, just like we got rid of smallpox. So why not be a part of that?
I love it. Well, I appreciate your time, Larry. Do you have any final thoughts on anything?
No, I thought that was a perfect way to end it.
To be honest, with how incredible your story and line of the first 8 minutes, everything else has been just kind of reinforcing.
It's very true. That was awesome.
Dr. Terry Simpson, I truly appreciate your time on here.
Nice to finally talk to you in person.
It's a pleasure.
We have been battling the carnivores for a couple of years now.
And then I told her the story one time where you and I are going back and forth, and we were talking about the Mediterranean, and I remember I had to just jab a little bit and go yes, Mediterranean has the best data as long as you control calories.
Absolutely. No, it's true. It's all about that.
Well, I truly appreciate you spending the time with us.
My pleasure.
If there's anything we can do to reciprocate value towards you, I'm looking forward to helping you in any way.
Yeah, where can people find you?
Well, I'm on TikTok at Dr. Terry Simpson, on Instagram at Dr. Terry Simpson MD, on Substack at drsimpson.com. So I'm easy to find.
Well, I'm gonna have to take you golfing sometime. That's how this is gonna happen.
I'm not a 5 anymore. I was many years ago, but I'm
really.
Yeah.
Nice.
I got down to a 5 after a lot of work, a lot of hard work. As you know, it's hard work to get down to there. And,
Lara experience is I would say 5 is one of the worst places to be because it's like you're so close to scratch, but
but so far away. It's like one.
You still have these weird shots where you're like, where did that come from? Like when you're a scratch golfer, that doesn't happen ish. It still happens, but when you're 5, all of a sudden you can just duck hook it left, and you're like, what just happened?
Most of my golfing career, I was in Phoenix. Most of my career, I was in Phoenix. And so we had a lot of professional golfers that lived there that I'd play with. And all of these guys, They were just so damn perfect. I mean, hitting it straight down. And of course, and I said, what happens in tournaments? Why haven't you won every tournament you're on? It's like, it's all here. And I
Yep.
said, well, it's not here for me. It's it's in my swing, which sucks.
Well, it was a pleasure. Hopefully, you have a great rest of your day. And for anyone
Thanks.
watching, appreciate you guys' time on here. And if you guys have any questions for new episode ideas, we're here to help.
Absolutely. Everyone, have a great day.
Bye.
Bye.